Does every little flutter in your chest send your mind racing? Do you ever feel like your heart's in trouble, even when your doctor says it's fine? Heart anxiety can feel terrifying, but what if the foods you're eating or avoiding are actually fueling the fear? In this video, we're busting the most common myths about heart anxiety and diet, so you can stop panicking and start living. Whether you've been told to eat heart-healthy or you're confused about whether sugar and caffeine are safe, we're breaking it all down, fact versus fiction. Heart anxiety, also known as cardiac anxiety, is a condition where individuals constantly worry about their heart health, often misinterpreting normal sensations like a racing heart or slight chest discomfort as signs of a heart attack. While this can feel frightening and overwhelming, it's important to separate fact from fiction, especially when it comes to diet and lifestyle. Let's bust some common myths and understand the connection between heart anxiety and diet in a more realistic, helpful way. Myth number 1. Heart anxiety means you have heart disease. One of the most common misconceptions is that if you're experiencing heart-related anxiety, you must have an underlying heart problem. In reality, heart anxiety is a psychological condition, often triggered by stress, panic attacks, or health-related fears, not a cardiovascular disease itself. People with heart anxiety may experience symptoms like chest tightness, palpitations, shortness of breath, and dizziness, which are also common in anxiety disorders. These symptoms are real and distressing, but they don't necessarily mean the heart is physically damaged. A proper medical evaluation can rule out heart disease, allowing focus to shift toward managing anxiety. Myth number 2. Eating heart-healthy foods will cure heart anxiety. While a balanced diet can improve your physical health, it is not a cure for heart anxiety. That said, the food you eat can impact how your body and brain respond to stress and anxiety. Nutrient-rich foods help regulate mood, energy levels, and inflammation, factors that play a role in anxiety disorders. For example, foods rich in omega-3 fatty acids, like salmon, flax seeds, and walnuts. Magnesium, such as spinach, pumpkin seeds, and black beans, and B vitamins, found in leafy greens, whole grains, and eggs, support brain health and help balance neurotransmitters. These nutrients don't eliminate anxiety, but they support a calmer nervous system, making anxiety symptoms less intense or frequent. Myth number 3. Caffeine and sugar are always bad for anxiety. It's true that too much caffeine or sugar can worsen anxiety in some people, especially if they're sensitive to stimulants. Caffeine, in particular, can mimic anxiety symptoms like rapid heartbeat and jitteriness, which might alarm someone with heart anxiety. However, this doesn't mean everyone with anxiety must avoid caffeine completely. The key is moderation and understanding your personal triggers. Similarly, while refined sugars can cause blood sugar spikes and crashes that affect mood and energy, natural sugars from fruits, when consumed as part of a whole food diet, are usually not problematic. The myth that all sugar or all caffeine must be cut out is too simplistic. Listening to your body and noticing patterns in your symptoms is more effective. Myth number 4. A low-fat diet is best for heart and mental health. In the past, low-fat diets were promoted as heart-healthy. However, not all fats are bad. Healthy fats, like those found in avocados, olive oil, fatty fish, and nuts, are essential for brain health and can actually reduce inflammation, support heart function, and improve mood. On the other hand, trans fats and excessive saturated fats, found in processed snacks, fried foods, and some fast food, can negatively affect both heart and mental health. Choosing healthy fats and avoiding overly processed foods is a smarter approach than simply eliminating all dietary fat. Myth number 5. You can't control heart anxiety. Without medication, while medication can help in some cases, especially when anxiety is severe, it's not the only tool. Mindfulness practices, regular exercise, quality sleep, and a balanced diet all play important roles in reducing heart anxiety. Techniques like deep breathing, progressive muscle relaxation, and cognitive behavioral therapy, CBT, can help retrain the brain to respond more calmly to bodily sensations. In addition, reducing alcohol, staying hydrated, and eating at regular intervals help regulate blood sugar and cortisol levels, two things that strongly affect anxiety symptoms. Hard anxiety is real, but it doesn't mean you're doomed to a life of fear or illness. By busting the myths and understanding the role of diet in your mental and physical well-being, you can take back control. There's no magic food or strict diet required, but eating mindfully, supporting your body with nutrients, and managing stress through healthy habits can make a significant difference in how you feel.